Hey YouTube, welcome back to my channel. My name is Dr. Daniel Kaplan, and my mission is to make psychology accessible to all. In today's video, we're going to talk all about binge eating disorder. So you probably have been following along the last two videos. We talked about anorexia nervosa and bulimia nervosa. And I mentioned that in the DSM-5, there was a newly added condition called binge eating disorder. So in today's video, we're going to learn all about the symptoms of binge eating disorder, the criterion that need to be met for the diagnosis, some specifiers depending on whether it's a current condition or a condition in remission. And then we'll talk about risk factors as well as the prevalence across various communities. So that is the lay of the land for this video. If you find this information meaningful, you learn something new, please hit the like button, the subscribe button, the notifications tab. That allows me to bring this content to a larger audience. But without further ado, binge eating disorder. So binge eating disorder has several criteria, but the first of which is having a binge. So what is the concept of a binge? Well, that is where a person eats in a short period of time amount of food that is considered significantly larger than what most people would eat in a similar time period. So usually it's less than 2 hours in time. We also understand that a person who has binge eating disorder reports feeling like they cannot control themselves during this binge eating episode, and they cannot stop, and they cannot even monitor how much they're eating. In fact, some people report dissociative properties where they get in such an experience of eating that they may be distracted and not pay attention to other things happening, such as the phone ringing. So if the phone's ringing and the person has a binge eating episode and they're in a period of mild dissociation, they might just let it ring to continue the binge. An additional criteria is that you have to have at least 3 of the following features. The person has to eat more rapidly than is normal. Usually a person, will sit down and eat. We give half-hour lunch break, sometimes hour lunch break. But if the person is eating faster than usual, if they report feeling uncomfortably full, or they eat large quantities of food even when they're not hungry, or they do this kind of behavior in secrecy, or they feel guilty about it, so they're hiding it from other people, and it causes additional distress on the individual. That is what we call binge eating disorder. Now, a person needs to have weekly binges that occur for at least 3 months in order to meet the criteria for binge eating disorder. And unlike anorexia or bulimia, this individual does not engage in any compensatory behaviors. They binge and that's it. So they're not engaging in purging, they're not engaging in excessive exercise, they're not engaging in fasting. All they're doing is binging. So that is the criteria for binge eating disorder. Now, I said we have various specifiers. Let's say a person has been working on the issue and they've gotten a little bit better. We have specifiers related to remission. So we could say if it's in partial remission, that's defined as having less than 1 episode per week for a sustained period. Now, understand that we're going to talk about how frequently a person must binge, even have a mild subtype, but it's certainly more than 1 time per week. So this would be partial remission because they're still binging, but it's not at a frequency that is at clinical level. We also have a specifier in full remission. This is a person who previously met the criteria for binge eating disorder, but no longer manifests any of the criteria or symptoms for an extended period of time. Now, the frequency of current binges, if it's not in remission, we can specify. So mild binge eating disorder would be anywhere between 1 to 3 binge eating episodes per week. Now, obviously, that's why we say in partial remission if it's less than 1. Moderate, on average, it's anywhere between 4 to 7 binges per week. Severe, it'll be anywhere between 8 to 13. And then extreme is anywhere 14 or more, 14 plus. So we have specifiers to tell the clinicians what we're dealing with here. So that's if it's current. Now, what are some risk factors for the development of binge eating disorder? There are 3 really important ones. One is if you have a family history. So if you have a direct relative who has a history of binge eating disorder or another eating disorder, that is going to increase the odds of you developing binge eating disorder. And we see that there is a genetic component. We also see that many times people develop eating disorders as a function of dieting. So they start a diet, they start to feel really good, and then it goes to the extreme. So dieting might result in restricting one's food intake. And as a function of that, that might increase preoccupation with food. And once that preoccupation with food occurs, there's the increased risk of a binge eating episode. So, and then other psychological conditions, things like unipolar depression or bipolar depression. It is possible for a person to eat when they're depressed, right? Or even in a manic state. So we have to be mindful that other mental health conditions could increase the risk for a binge eating disorder. So what is the prevalence? So if we were to follow this across for 12 months, we see that it's about 1.6% among females and about 0.8% amongst males, which means it's about 2 times more, or exactly 2 times more likely among females. In terms of the life course, this can occur at any point in the lifespan, but in general, we're looking at the late teens to early 20s as the common starting point. We see that this is more prevalent amongst people who are in weight loss treatment, as we talked about dieting, than the general population. The United States' prevalence of binge eating disorder is comparable to other industrialized and Western nations. And there are no real significant differences across ethnic groups. So that is binge eating disorder. I hope you found this video useful. So now you know the criterion for the condition. Now you know the various subtypes and specifiers, the risk factors, and the relative prevalence. Once again, hit the like button, subscribe, click the notifications tab for more videos like this. Take care, everybody.